The enrollment period is underway for Mass Health, and here to offer some advice on considering the options for coverage is our guest, the Vice President of Marketing and Public Health Plans with the Tufts Health Plan, Juan Lopera. Thank you much for being with us.
Thank you for having me, Chris.
First of all, talk about the deadlines that people have to have in their mind. What are we talking about now?
That's right. Right now we're in the open enrollment period, which started in November. It goes through January 23rd. During this period, people can look for different options and can enroll, can change plans if they like to. I do encourage people to not wait until the last minute, until January 23rd, and try to enroll by December 23rd so that the policy can take effect on January 1st of 2019.
Now, there have been a lot of changes nationally in terms of healthcare offerings and mandates. And I guess some people in Massachusetts might be saying, I'm not sure I want to spend the money on healthcare. Do I really have to get it?
Yeah, there have been a lot of conflicting messages coming from Washington. The reality is Massachusetts continues to lead the way when it comes to healthcare coverage. We have almost 100% coverage, about 97% or a little more than that. So we've been leading the way, and while there may be certain changes coming out of Washington, Massachusetts continues to push for everyone to be enrolled. So next year, federal penalties related to the individual mandate will no longer be in place, but Massachusetts will still have those penalties in place to ensure that everyone is covered.
Well, as you mentioned, almost everybody is covered, but for people who are not and who might be afraid that they cannot afford it, what about the kinds of subsidies that they would be eligible for?
That's right. So the Massachusetts Health Connector on mahealthconnector.org has a lot of information where you can look for plans that meet your needs, and you can also determine if you qualify for a subsidy based on your income level, essentially where you lie from the federal poverty line. There's different subsidies available based on income, basically.
And I'm guessing that even people who have some fairly decent jobs and raising kids, they might be eligible to get something from here.
Definitely. Folks are encouraged to go online, and when you put all your information that is required, including your income and a number of other requirements there, you'll be able to know whether coverage is available with subsidies. And if not, there's a lot of good options. There are 57 different plans people can pick from 9 carriers that we have locally. So there's a lot of good options, and it all depends on the level of cost share, the deductibles and the co-pays that people are willing to bear, as well as the size of the provider network. Those are things that people can look at when they're comparing different options.
This is BNN News, and we're talking with Juan Lopera from the Tufts Health Plan. Juan, what about people who might say, well, I have a plan already, I've already enrolled. Do I have to, go through the trouble of doing something again this year? And why should they?
Right. I always encourage folks to go online and ensure that they confirm their coverage. It's always good to shop around and see if there's more affordable options available to you. There are going to be a number of folks that if they take no action, they'll just be enrolled again for next year. There will be a number of people who may get a letter from the Massachusetts Health Connector indicating that they have to validate their coverage. Based on income, things may change, and folks may have to look for a different option. But a good number of folks will just be able to carry over their coverage. Although even for that group, I would encourage them to shop around.
Well, a lot of people, I think, primarily would be looking at their caregivers. They might like most of the people they have, so can they continue getting care from them if they go to another plan? Is there something that allows them to do that?
That's one of the most important things to look for when selecting a plan is your provider in the network. There are a lot of different options of plans. I mentioned there are 57 plans. There are some that have limited networks. There are some that have wider networks. So it's always important to look to see if your provider is included. So that's one of the things that should be part of the shopping experience is my doctor in the network.
I imagine right now most providers in this state, they are being incentivized not just to get reimbursement for procedures. They're trying to get long-term results that are healthier. What does that mean in plans?
Yeah, I mean, historically, the system has been billed as what is known as fee-for-service, where you get paid more for doing more things. And now there's this move to value-based care, where you're actually being held accountable for the quality and for the overall way you manage the cost of a population. So what that means to individuals is probably, you probably don't see it as much as an individual. It might be seamless to you, but providers are trying to take better care of populations of patients in a more patient-centered way with more integrated teams, including not just your primary care doctor, but a lot of other support systems, whether it be in your community through social workers, whether it be through nurse practitioners and other ways of managing your care.
It also tells me that some people should look carefully at coverage for things like screenings and wellness features and plans.
That's right, and that's one of the benefits of the Affordable Care Act is that many of those preventative type of services are now covered without cost share, meaning that there's no copay involved, and that's certainly a benefit of what was implemented in the Affordable Care Act.
We should mention that if people want to get some more details about the process and some of the options, anything that you'd recommend?
Certainly go to mahealthconnector.org. You can also call directly, it's 1-877-MA-ENROLL. So those are two good sources for folks who need assistance. And, the process can be daunting for some who are not used to it, so certainly seek help. There's also office hours that the Connector has available in different parts of the city and throughout the state. So there's office hours if you prefer to go in and talk to someone. You can there's walk-in office hours from 8 to 6 p.m. Monday through Friday.
Thank you very much for being with us.
Thank you.
Juan Lopera from the Tufts Health Plan.